What measures are you taking to ensure that the message is cascaded to the most remote areas? Because no youth, less number of youth are reading the newspapers as we speak. They only rely on these cell phones and other digital. Then the other one is on the issue of school curricula. What efforts are you taking as an institution to ensure that the same information is included in the school curricula? Because we can't hide that, as you have said, the youth are engaging. That is the main elephant in the room. So that's also the area I wish to hear from you, since most of the people in this age group are of school going age. Thank you.
Thank you. Any other questions from
Thank you, Madam Chair. Thank you very much, CEO, for your presentation. I would want to agree with you on your concern regarding the 10 to 14-year-old adolescents. What it means is we are talking of a group which is not able to make decisions, which still needs guidance from parents. And what it brings is, if this group is not looked after or educated on the effects of indulging into these activities, at the end of the day, when they are matured, when they want to get married, some of them will not be able to have children. Maybe it's because they would have used the precaution or prevention methods for a long time. They've been infected with HIV. So my question is, as a council, what are you doing to make sure your outreach gets to the bottom of the whole issue? Maybe how are you going to reach out, especially to the people in the countryside? Considering that they don't have access to information as we might expect. In some areas there are no TVs, there are no posters, and also considering peer pressure from friends. Then my other question is, I know maybe this question will disturb you a bit, but I really think that you need to think about it. Considering the pandemics that we have been going through, including HIV, the COVID, and the new cancer on the nation, the drug abuse, what will be the effects of family planning to our population growth? As much as we would want to decide on the number of kids, but the effects of these pandemics and the drug abuse vis-a-vis the population growth. If you were to ask me, in my family, I'm number 6. So if my parents had stopped at 4, maybe I was not going to be here. So I am asking this question, trying to put across issues that will affect the nation in the long run. Maybe you'd want to come up with a model to educate our communities, so that at the end of the day, they don't see this as a scapegoat to say, I'm going to have one baby, or I'm not going to have a baby at all. But you are saying, we are giving you a choice to decide. But on the other side, look at the after effects of all these things that I've said. Thank you.
Thank you, Honorable Mthuli. Let's give the CEO to response on what was discussed. Then we will take the second round.
Thank you, Honorable members.
Can you put your mic on?
Thank you, Honorable members, for the questions. I really appreciate it. And I'm just going to run down and try to respond to them. MASH syndrome. It is very true that in terms of major reproductive health indicators, MASH syndrome has got what I can call waste rates or waste indicators in the progressing of it. But what is more important is not, number one, on the figure, but how are we progressing in that province, vis-a-vis what are the underlying factors in that province, also pushing towards those indicators. We can talk of teenage pregnancy. In my center, it is very high, I think around 37%, 31 or 37% in my center, teenage pregnancy. And if you then want to corroborate it with child marriages, they are also rampant in my center. And what is very critical and key on that is to address using the socio-economic and cultural perspective. It does not require us to contextualize it using other provinces or what. Let's look at the socio-economic, cultural environment of the province. This is where you also see that in terms of discussing, of course, in other provinces it is there, but discussing comprehensive sexuality education, we still have some challenges for us to get audience. And we need to address that. Meaning to say, once we then address the underlying factors, let's look at poverty in the same province as well. Most of the young people are now dropping school, going for goat panning, illegal and informal sectors. But these are also the hotspots of these instances, of these challenges as well. I had an opportunity to visit one of the informal sectors I was passing through, to going somewhere to bury my auntie. The environment is not that conducive for a young person to be protected. And we need to ensure that as a country, we look at means and ways either to formalize some of these and put structures which then protect our young people, and also to ensure that we conscientize them on the importance of school furthering with their schools, with their education. And then we need income generating projects or initiatives in the same province as well. We have been talking and sensitizing, educating for decades, but the underlying factor comes back to poverty. Let's have income generating projects. Let's have information hubs to empower the young people. That's why as council now we are resorting to these life skills and income generating projects to try and see if we empower them economically and mentally as well as socially, if we can still have persistence of these public health challenges. The other thing is we also need to consider even the effects of climate change in the same province as well. Of course, other provinces being affected, But to what degree are we witnessing this? Meaning to say that's another area we need to address as a country in terms of the devastating effects of climate change in Marsh Central. That's how best we can then address these challenges which we are continuously realizing in Marsh Central. Then the other thing is definitely we need to strengthen our relationships with the gatekeepers. And by the gatekeepers, I mean our chiefs, our sub-crews, our councillors, our MPs, our school heads, everyone who lead a certain constituency. We need to train and teach from that level down to the consumers of the services so that we can get buy-in. I'm happy we've got some honorable chiefs in here, and then they will appreciate the importance of these youth talks. From there, if a word is coming from an honorable chief, buy-in is guaranteed in most cases. But if we then don't involve them, we are most likely going to face resistance. Meaning to say, in our programming in Marsh Central, we then need to ensure that for us to address these, we work with the relevant stakeholders, the relevant authorities, including even the school teachers and also any other relevant office to address this. Continuous, we teach them. Then, in terms of reaching out to the out of school, yes, Honorable Chair, I totally agree with you that we need to understand how we do that. As council, we have got what we call peer educators. And peer educators, they are also below 24 years. And they are within the communities, rural communities. And they are chosen by community members in that respective constituency. So we train them to be youth friendly, we train them some basic clinical information for them to provide to the young people. And these are the cadres who assist us to mobilize those who are out of school. And then they come to the youth center. When they come to the youth center, we then provide information and any possible clinical service. We also venture into sports as council. We have got outdoor games and indoor games at the same youth centers. We have got chess, dart boards, tinema soccer teams, tinema clubs, a debate, and they come for those interventions. When they come, we give them health talks, we give them services as well. That's how we lure out of school people. And some of the peer educators are also the out of school peers within the same communities. So it becomes very easy for us to then reach out to them. And in terms of means and ways, we use the WhatsApps. We have my WhatsApp groups where we continuously train them online. We also have my Facebook, Instagram, everywhere we think and feel we can reach out to a young person. We are there as a council. Then in terms of our awareness campaigns, let me assure you that ZNFPC does not focus in urban areas only. And if I can say correctly, we are in the rural areas where we are moving the last mile initiative, and we target the hard to reach and marginalized areas. And as a coordinator as well in terms of sexual reproductive health services, we have got what we call service delivery mapping document, which we use to say, okay, service provider A is in Chipinge in Ward A, and when service provider B comes, we are not going to allocate service provider B in the same area where service provider A is, because we want to avoid duplication of effort. So we then spread to other areas where there's no, the services are not available through that mapping. And in terms of our rural reach, those peer educators and the community-based distributors they are trained to be youth-friendly, and they assist us to reach out to those within the rural areas. But we do not work as council in unison, no. We also collaborate and partner with other organizations who are also working in the rural areas. And from there, those synergies, they assist us to reach out to many. Then In terms of traditional leaders, we do work with the traditional leaders very well. As council, we have got number one, a program on male involvement, which we do work specifically with traditional leaders on male involvement. And on male involvement, we are trying to encourage a health-seeking behavior amongst men, and also to ensure that they also appreciate the importance of reproductive health and support their partners and spouses as well with regards to access and utilization of services. So we do have other standalone programs, and we also have one which we call moonlight sessions. And through the moonlight sessions, we are reaching out to the hotspots during the night. Why? Because we know that's when we are going to reach more males. Either it's a drinking area or it's an area where we know men will be gathered discussing something. We then go there and then we provide our information. And we are getting support from law enforcement agents among other line ministries as well. So it's progressing very well in terms of reaching out to males and also reaping the benefits as well. And also in terms of not only traditional leaders, but other leaders, parliamentarians and religious leaders. With parliamentarians as ZNFPC, it is now on our calendar that we conduct advocacy initiatives. And we also call in Youth Portfolio Committee, the budget, youth, the women, and also the finance, as well as the judiciary, parliamentary portfolio committees. And we then gather through those parliamentary advocacy engagements. We discuss the issues affecting the program, and we also proffer recommended solutions and hear from parliamentarians as well. Then from Chief, you asked about, I think I responded to it on how we are working with traditional leaders and other independent initiatives as council, which we are implementing. I think that was your question, is it? And where I talked about the male involvement program, the moonlight dialogues, and also the other one is we have got my sports colors, and we usually ensure that the chiefs are involved in that, to ensure that we have a gathering of people in the constituencies. Then from those sports colors, we then provide information and we target the young people as well. And we don't work without the chiefs as well. Then we have parent-child communication, which is also another independent initiative from the council. Parent-child communication, we are having the parents, the guardians, together with the children, and then we discuss issues to do with the reproductive health with the mixed house. And then from there, we ensure that we trigger dialogues even when they go back home to discuss about these issues. So it also includes even menstrual health and management issues and how to manage it as a family. Then the digital effect, I totally agree that the phone, it can then spread either correct or incorrect information. But as council, we are also there in all the social media platforms, and we follow almost all the issues to do with the reproductive health and ensure that where there is incorrect information shared, we then counter and provide the correct stance. And once we do that, we also need, through you, Chair, in the House, if it is possible, as a country, to have some, this is now me thinking and brainstorming. And other countries, I'm pretty sure that they are doing so. Is it also not possible that we can even have restrictions in terms of the content our young people are accessing? And once we do that, it can limit in terms of the influence social media is giving to the young people. If you go to countries like China, they have got strict measures and strict counters in terms of access to certain information, and then the government controls. Meaning to say, it is us now as a government to control what we want A to know, what we want B to see. But if we leave it open, Mr. Machinga and the team will go to Buera and then provide correct information. The guys, the girls, the young boys there, they will understand and appreciate. Here comes the enemy. Just a few seconds after myself and my team leave Buera, this enemy will also derail all the efforts. Social media is there with another incorrect and influencing information. So this is one of my plea to you, honorable members. If we can have a policy to restrict, and it has to be age specific. But however, as council, we are also doing something through those PA educators. Our social media platforms then spread and continuously give correct and consistent information. Then in terms of school curriculums, and we are working hand in glove together with the relevant ministries, Ministry of Primary Education, also including the higher and tertiary education. And we are working together to ensure that we standardize and harmonize our activities. When we go to schools, we go together with the relevant line ministries and we agree on certain activities. And in terms of our outreaches to ensure that they target young people, what are we doing as council? We have got the youth centers, and youth centers are not in town. They are deep in the jungle, in the communities, in the rural areas. And usually the committee, those will also work with the committee. And those youth centers, they assist us to ensure that we reach out to the young people and they give specific information to that. The challenge now is we have got very limited youth centers. There are only 24 in the country. 24 cannot save the country. One province has got 2 youth centers. Would they be sufficient enough to save the whole province? No. And we need more structures. Give us more structures. Even if we are to get land, Honorable Chair, we can construct some structures to provide youth-friendly health services. But we don't have, and we are limited as council. Then in terms of, so we do not have head office only. We also have provincial structures, and they also assist us to reach out to those in rural areas. Then in terms of the pandemics and their effects to our population, this is very true. It is so sad, but this is the reality. And it requires concerted effort as well for us to address this. But in terms of how we should then react, as council, we are not only providing contraceptives, Chair, we also provide comprehensive fertility services to assure you and guarantee you that we are not only there to limit or to reduce the population, because we are going for those who are with fertility challenges, and then we ensure that they are medically addressed. So that should assure you that we also have a concern on that, because we don't want our population to reach the, what do you call it, when it's beyond replacement. When it's beyond replacement, it's not even economically viable for us. And also even in terms of defense and security, it's not even viable for us as a country. So we need to then tally our social economic amenities with our population as well. So it's one of our mandates as ZFC, not to reduce the population. And in terms of, I think those were the questions, Chair. I'm not sure if I omitted any question in my response.
Honorable members who asked if your question came. Honorable Chief.
Thank you, Honorable Chair. My question was responded to, but I didn't want to interrupt the floor to supplement as you was speaking. Can I pose it as a supplementary to what I does?
Then go ahead with your supplementary.
Madam Chair, just a flashback. I'm almost 20 years as a traditional leader, serving, and I have never left my community. But may I categorically put it that I have never partnered with them. I know ZNPC by general knowledge. We have never worked together. But I'm not saying they're not doing anything. Zimbabwe is too big. They could have been working with other traditional leaders. I come from Binga. I have never worked with them. I've never seen them. To me, they are very thin on the ground. I don't know where they operate from, or maybe they've got their own hotspots. Maybe my community is very safe. But I just feel maybe we can do better with them. Thank you.
Thank you, Chief. I cannot object, or I cannot say it's true, but what I want to appreciate is which constituency. That's number one. Number two, in terms of, let me say, youth centers, in Binga we have got, is it simple? Lusulu area. And in Lusulu, we have got land which we also intend to construct a youth center in Lusulu. I'm not sure if it is close to the Honorable Chief's area.
Indeed, I share about that.
Yes, that's where we are also trying to reach out to the Binga communities. But besides the youth centers, we also conduct outreaches. And like I said, as ZNFPC, we will not cover all the points because of our constraints. Number one, program vehicles. I don't have program vehicles which are enough for even every province. Talking of Martinoth, Honorable Chief, I only have one reliable truck in Martinoth. One old double cab BT50 in Martinoth. And then talking of even the operation grant, which I'm receiving from Treasury to complement and also to support my programming. 2025, I received 0 ZIG. 2024, I received 100,000 ZIG to share with the war provinces. And I am supposed to reach out to my Honorable Chief with his consent in his constituencies with 0 budget disbursement to ZNFPC, and also without a program fleet. I don't have. And if we are also going to talk of the viable models and means, Chair, I need mobile clinics. I don't even have a single caravan. But through our partnership and collaboration with stakeholders and partners, this is how I'm reaching out to the communities and the relevant constituencies. But as ZNFPC, if I am to have caravans, mobile clinics, if I am to have a fleet, I don't even want to be overambitious and have 5, 6 or what. No. Even 3 will suffice the whole province, but I don't have. And the budget, if I can get the allocation from Treasury, I will be able to ensure that the little I can from those little resources, I can then implement. But what am I going to do at a 0 budget the whole year? What am I going to do at 100,000 ZIG the whole year? 2026, I haven't received anything operational in the program, in the capital grant. Capital grant, I last received capital grant in 2021, if I'm not mistaken. And I'm supposed to pay utility bills, I'm supposed to service those vehicles, I'm supposed to maintain the buildings. So, Honorable Chief, when you say you don't see us and you are very thin on the ground, I totally agree, because I haven't reached your constituents. But that's not my vision as council. I want to ensure that I reach out to every individual in the country, leaving no one and no place behind. Our efforts to have a center at Lusulu, they are going nowhere, they are fruitless. Why? Because I'm constrained, I don't have resources. That's the situation, Honorable Chief. But I will ensure that 2026, you're also going to come back and give a testimony that I saw my children in my area.
Thank you, Mr. Matinga. Those who asked it, we also spread now because last thing was I've seen you.
Thank you
I'm just
for
looking for something that
thank you for clarifying on the issue for the social media handles. But I'm one person who's always on social media, and unfortunately, I haven't come across the programs you were saying. Would you mind sharing with the committee your social media handle so that we are able to ascertain as to how much have you gone through that? Thank you.
Thank you, Honorable. Honorable Jean.
Okay. Thank you, Honorable Chair. First and foremost, I want to thank the Chief Executive Officer for the elaborate presentation that he gave us, and also to say that it would appear that now he has started reporting, to the members of Parliament, because the reason is that we want to perform our oversight role, and we need to know the situation, because I was having many questions around the capacity of ZMPC, since they are of a national catchment, and also to know how many community distributors they have and what are their conditions of service, those community distributors, because they form the backbone of their work, given that they are into outreach as an institution. So I think now when he talks of a zero budget, then I begin to really become very nervous, Honorable Chair, when somebody talks, like ZNFPC, saying that since January they've not received any support, budgetary support, and the whole of 2025 they didn't receive budgetary support. And I also want to say that in the past, when these Mbuya Utanos or the people that are marketing or distributing products, when they get to a home of a disabled person, they apologize and say, sorry, no, you sorry, what, then you say, no, mama, I'm glad to say, mufamba door to door, I think I'm lost here. Then they go to the next, to the neighbor, and not addressing this other, household, because they've seen a disabled person. And I also want to say, Honorable Chair, that in my other work in December, a group of blind women wanted to be addressed by ZNFPC concerning reproductive health issues and so on. And we asked somebody who is actually a provincial officer in Blawa, a lady. And then, she professed ignorance about it. She was surprised to say, ndakatozuti mama asingaoni munotodawo kuti muda varumewo munodiwa nevana, ende vamwe ndafunga kuti vana vacho vatinoona muchikumbira navo havasi venyu, from now onwards we'll partner with you and so on. So it's not correct that the program is reaching persons with disabilities. I've just given a small example yatakaita kubulawayo tichishanda nevamwe vatakatsvaka vamwe maika mungazoda outside the meeting I can give you even CV yavo ndinayo ndakazoti kuti report and so on. Saka tiri kudaiza kuti toti to expand that relationship and so on. So I think honorable chair, sokuona kwangu pane need yokuti kurukure pamusoro kuti how nyaya dzebudget dzine nyaya dzekuti apa vamboti vane macenters 11 vachiti macenters 11 asi vati kuHarare kune 2 kuBulawayo kune 2 so saka zvoona kuti maprovince maviri anokwanisa kunge asina macenters ndeati maprovince iwawo saka and why and so on. Saka pane a lot of things ndaona sekuti dzinoda kuti dzigozotarisiswa chaizvo paripoti yavo. I thank you, Honorable Chair.
Thank you very much. There was a hand.
Oh, it was
Someone
me.
else. So if we can be fair so that we can
Yes.
that.
It's just maybe a minute thing. Thank you, through you, Madam Chair. I just wanted to say thank you for the well laid out presentation, but I want to appreciate what the Honorable Chief did, because when you come and make a presentation to us, we appreciate what you say. We want to hear the good and the bad, your challenges and everything. So it only became complete after the chief had provoked you to say that. So I really appreciate what my chief is my chief anyway, what my honorable chief said, because it has made us to get a full report from you. Thank you so much.
Thank you, Madam Chair. Thank you, Madam Chair. With the report, I noticed the policy inconsistencies which the CEO have raised, and you are saying there's a problem with the gap of 16 and 18 years, which is very correct. Through you, Madam Chair, my question is, how do you do as a council when a young boy or young girl visit? I mean, is the young boy and young girl protected when you visit the centers and meet a nurse or a nurse? Is he protected when he met a nurse or whatever? Are they, in short, what are they trained to handle such issues when they meet these people, which we regard them not to have in sex or these other activities? As Africans, we agree that it's a taboo that they're indulging in sex. Are these service providers trained to handle such issues when they encounter that? Then the other part is, on your report, you're saying we are out there in the rural areas. We are conducting the awareness. And on your chart, we said there are 11. And I didn't even see one in March North. There's only youth centers, about 2. And 2 centers to cover March North. I don't think it's enough. I don't know. Is it because of the constraints of resources, or is something else? Or is March North is not part of Zimbabwe?
Thank you, Madam Chair. This will be my last intervention, and it's very important you like it. Madam Chair, I'm asking this because of my other field of work, Yobita Mambo. We normally have issues. Vanhu vanouya kumatare vaakurwa kuti aiwa ndakamurovera kuti ndakazowana aine mapiritsi mumba. So do you have any legal framework that supports women or protects women kana vanotora mapiritsi acho murume asingazvizivi? Because isu kana auya kudare tinoita kushandisa chivanhu chedu, culture. What does culture say? Ivo vanoitirei murume asingazivi? Saka, do we have any legal framework that protects these women, or does law compel them to tell their spouses first before taking my periods? Ndapedza, Madam Chair.
Thank you, Madam Chair. Let's give the CEO chance to respond.
Thank you, Madam Chair, and the esteemed honorables. With regards to social media handles, we are very comfortable to share. We will definitely share all our social media handles where we are, and I will be very much happy to also see the followership of my honorable members as well, so that we work together. And I also believe that the moment we share, we're also going to get some of the unique challenges affecting different constituencies as well. We'll definitely share. And then in terms of what Honorable Joe talked about, indeed, the capacity which we have currently, Honorable Chair, is not at full throttle. Meaning to say it is also limiting us in terms of our mandate, resources. Of course, the financial of it, I have talked about it, where we are not getting the finances. Out of the human resources as well, we also need to be assisted to ensure that the frozen posts of the community-based distributors, if we can get treasury concurrence to recruit them, that will also expand our reach to the furthest areas as well. Meaning to say, currently I have got, I think, a quarter of the CBDs, of the community-based distributors, out of the supposed staff establishment. I don't have full staff establishment with regards to the community-based distributors. Those are the cadres who are also acting as bridges between the static clinics and the communities in terms of service provision. And if we have got the treasury concurrence to recruit them, I think it will also somehow assist to reach out to many people, and then we train them. And in terms of their conditions of service, we also try as council to ensure that they are equipped with job aids, of course, within the limited resources. Those cadres should be having, for example, bicycles or motorcycles so that they can reach out to many. But currently, we have some constraints to ensure that they have got those accessories for them to reach out to almost everyone. But we also try as council to ensure that they reach out to the possible furthest areas within their constituency. Then, yeah, I really want to apologize for that statement, Honorable Joe, which is misplaced. And within our core values, we don't judge. And that's why I said in my presentation, we work with persons with a disability, we consult them, we involve them, we don't plan for them. And just to give you how far we have gone in terms of their inclusivity, whenever we are conducting forum meetings or conferences with other stakeholders, in other provinces, we already have trained staff to give sign language and other formats in terms of our communication. So we now want to train almost every province should have a trained somebody to translate into audio-visual communication channels. And in Manicaland, we're already doing that. And if I was using my laptop, I was going to show you some of the videos where we are embracing persons with disability. And in every event, we want to ensure that they're involved. Our information has to be in braille, audio, visual, and we are doing that as well. Then I think we have a side discussion to understand and appreciate that. Then in terms of the provinces without clinics, we don't have a province without a static clinic. That's why I said there are 11, meaning to say every province has got a static clinic, and then additional 2 are in Bulawayo and Harare. I hope my mathematics is balancing. It's not.
No, it's not balanced. You said there are 11 in total, but we have 2 in Bulawayo and 2 in Harare. What is your total first?
Okay.
Give us your total first and then we get in.
Now I get it. The way we then put our provincial boundaries, we have got Manicaland, my central, Mat North, Mat South, Midlands, Mashingo, and then Mash West, right? Then these, they've got each static clinic. Then from there, we then go to Harare. Mashist is there in Marondera as well. Yeah. No, every province. My central will be Binduri. No, there are youth centers and static clinics in my church. Yes. Yes.
Okay, no, it's okay.
Honorable Chair, I see Mukunda still. What else we are here, like about I see Mukunda better.
Oh, in terms of Mat North, Mat North, and it's in not Bulawayo Iriega, and then Mat North Yega, and then Mat South Gwand.
Bulawayo is a province.
Ndo Patrigura Sanga.
And then
Harare is a province.
So
Harare is a province.
Bulawayo ndo mune. Meaning to say boundary matter, but aru Bulawayo ndo Edward Matwa. Do I not cover Matwa?
He said what matter.
Hey, was I don't blow and run cover Martin.
Don't put the province as in because the Mungo might have 4 Mutu province.
Yeah, that's very true. And that's where the discrepancy is. I don't blow why you do not save Martin. Yeah. Then I'm not sure I'm paying any single pin. I'm not sure if there's any.
So, honorable members, those are the responses. But I know you have a lot of questions. Can we put the questions on paper, we give them to our clerk, and then she will forward them to the CEO, and they will get our answers. That will help us because of our time. But before we end, I just want to say to the CEO that finances are a problem everywhere. This is why there's some private partnership. If you try that angle, it may help or it may not. But most people are getting the service they want because they've partnered with the private sector. And also, for this program to succeed, we need a multi-sectoral approach. You involve the education ministry, which you are doing, and because we are dealing with the children. And they were talking about land, we have the Ministry of Lands, they do that. And municipalities in the rural areas, because there is CDF, which is being given by Parliament to develop the areas where the honorable members of Parliament manage there. So if you include these people, you cannot do it alone. It's impossible. So I think that would help to end these financial problems. And the other thing I want to recommend you, which you are doing, is the male engagement. Because we have a problem that if we want to succeed, to empower a girl child, we just talk about girls, and we leave out the males. And yet most of the time, they are the perpetrators. So if we include everyone like we are doing, we'll get somewhere. And then, lastly, I just want to ask you that when you are inviting other committees, don't forget that there's a thematic committee on HIV and AIDS. You do some activities. We hear that the Ministry of Health has gone there, the portfolio committee on health has gone there, portfolio committee on this is gone there, and yet when they are there, you will be talking about HIV, and yet the thematic committee on HIV is left out. So I'm just requesting, kindly requesting that when you are doing such activities, advocacy, don't forget that there's a thematic committee on HIV and AIDS. And once again, I just want to thank you for coming to give us the information which we had asked you to furnish us with. So this is not the last time we are going to call you, because the thematic committee on HIV is here to stay, and it is a problem for the nation, and we should work together. So next time we call you, we'll be looking forward to meeting with you again. Thank you so much.
Thank you, Chair. Thank you, Honorable Member.
Thank you so much.